Hi, welcome to Lakeview Health. I've been here for about 20 years. I'm going to be taking you on your tour today. Here's our men's facility, the Star. In this building, we're going to take a look at the Bistro, our expressive arts rooms, the libraries. It was very intentionally designed for men.
So my name is Phil Warwick, and we're here at Lakeview Health at our STAR facility, which is our men's facility. Here we use a gender-responsive treatment program. And what that means is that we have tailored our program here at the men's facility specifically for the men that come through and take part in our program. So everything from the curriculums to the design of the buildings to the therapists that we've chosen for this facility here work toward emphasizing the importance of that gender-responsive programming. And it's that individualized care that allows us to really make such good progress with the patients.
This is the men's bistro. This is probably my favorite place on the entire campus. So one thing I didn't share with you guys is that I was a therapist here for 10 years at Lakeview Health. When I got the opportunity to be part of the design team here, one of the things I remember talking about was, what did my men struggle with the most? One of the things that I remember the men saying is, will I ever be able to go and watch a football game again? Will I ever be able to go out to a restaurant with my friends or to a business meeting? So yes, this does look a little bit like a pub, and that was very intentional. We wanted to do a little bit of exposure therapy with our patients in this space. And one of the things you'll see is we have things that look like bar stools. We also have a big screen TV that comes down. So we do sporting events, Super Bowls, we bring in chicken wings, all the fun things that they like to teach people that yes, you can do this stuff and you can stay sober. This is the library. This is a space where our professionals, or really any patient, can come and have a place where they can get away, do some homework, or a place where they can read, or just a place to relax. It's important when working with our patients that we not only offer talk therapy. Some people just don't connect in that way. So you have to offer a lot of different modalities in treatment in order for different patients to be able to connect in different ways. This is our experiential art room. We do lots of cool things in this room with our patients. We have music therapy, art therapy. This space was intentionally designed to create a space where our men can come in and try different modalities of treatment. This is our women's program, The Rose. I'm going to be showing you the bistro, the meditation room, and our spa bathrooms. You're immediately going to notice that it has a totally different feel than the men's facility. We used a ton of bright colors, lots of purples, wanted to make it feel very exciting and bright when a patient came into treatment.
Hi, I'm Mandy Jack. I'm the Senior Program Director for Lakeview. Welcome to The Rose. Here at The Rose, we have all of our staff trained in trauma-informed care, and we also provide gender-responsive treatment. So we work hard to create a safe space for our women. Treatment is challenging, and we want them to feel safe and comfortable so they're able to be vulnerable and do the hard work that they need to do in treatment.
This is our women's meditation room. We use this space for all kinds of things. We use it to de-escalate a patient that might be struggling with anxiety. We do peer interventions in here. We do yoga classes and also mindfulness groups. So right now we're in the women's spa area. This space is available to women after they complete their detox protocols. There was a couple things in mind when we were looking at this space. One of the thoughts that came to our mind is that oftentimes our women come into treatment and they haven't taken care of themselves in a long time. They've been caretakers in their families, taking care of kids, the husbands, whatever it might be. And this is a space where they can come in and feel important and valued. It is designed to look like a spa, but it's very therapeutic in nature. Another thing that we talk about with women is that oftentimes they come in with significant trust issues. Some of their relationships with other women haven't been so great. This space kind of forces women to come together and spend time doing their hair, getting ready for the morning, so everything is very communal in nature. So now we're in the women's dining area. This space is really special because we knew that when we separated the genders and we were treating just women in one building, that we would see an increase in some behaviors related to food and eating disorders. Anxiety sometimes increases for women centered around meals. So what we did was we tried to make it feel like you were eating at home. We added a long communal dining table so the women can eat together and talk and break bread together and sort of reduce that anxiety that can come with meal times. So I think it'd be really important for you all to meet Lexie Leanne, our alumni and aftercare supervisor.
Hey guys, thank you so much for coming by today. So I'm actually an alumni of the program myself. I came through in 2015. our alumni coordinators spend a lot of time with the patients while they're in treatment here at Lakeview Health. They run recovery coaching groups. They'll even try and hook them up with temporary sponsors. And then they get them all signed up for our alumni program post-discharge, which is going to entail a lot of phone calls, a lot of contact on social media. We have a private Facebook group, which has over 2,000 alumni in it. And then we also have our own alumni app. And so that is all Lakeview Health alumni in there. And we also have an aftercare department here at Lakeview Health. And so our aftercare coordinators are going to start meeting with patients about 2 weeks into their stay with us. They're going to introduce themselves, let them know that we're here to help them with any kind of resources or appointments when they leave here. And we're really going to start letting them know the benefits of aftercare and why it's so important to continue treatment after a residential treatment stay. And so we're gonna help set them up with anything from sober living to intensive outpatient to individual therapy. We make sure that everyone, while they're here, they know their aftercare and alumni coordinators, and they're set up with a really good aftercare plan, and then we follow up with them with a pretty intensive alumni program as well.
I'm really excited to show you guys this space. This is our Health and Wellness Center. I had the opportunity to travel to about 20 treatment centers to see what they were doing for health and wellness. We really wanted to take an integrative health approach and look at the whole person when they're coming into treatment. I'd love to introduce you to Norm. He's one of our exercise specialists here at Lakeview Health.
Our wellness center is 10,000 square feet. Upstairs is an indoor track. It's shock resistance. We also provide our patients with a protein bar. And that's where we also conduct our physical therapy evaluations and our physical therapy sessions. Our patients are allowed to come to the Wellness Center 7 days a week, so we provide them a safe and effective regimen regardless of their exercise background. Anything that the patients may need to help them be more physically fit and also educated before they leave Lakeview on the out end. We provide them with an exercise regimen that they could take home. They'll follow this regimen. That way they will be much more successful in recovery when they go home.
We really appreciate you taking the time to watch this video and get an idea of what goes on here at Lakeview Health and all the great work we do with our patients. We wish you could be here in person. Thank you for watching this video, and we hope to see you soon.